Delhi's smog emergency, a city gasping for breath. Delhi is facing an air pollution crisis. The air quality has reached alarming levels in 2024. The city is grappling with one of the worst air quality indexes in recent history. The city is covered in a thick blanket of smog. This makes it hard to breathe. Residents are forced to wear masks even indoors to protect themselves from the toxic air. Visibility is also very poor. The air is heavy with pollutants. Commuters struggle to navigate through the dense fog, making daily life increasingly difficult. These pollutants are harmful to human health. They can cause respiratory problems. Hospitals are seeing a surge in patients with breathing difficulties and other pollution-related ailments. They can also worsen existing heart conditions. The situation is particularly dire for vulnerable groups. The elderly and those with pre-existing health conditions are at a higher risk. Children and the elderly are most at risk. This air pollution crisis is a major public health emergency. Schools are being forced to close, and outdoor activities are severely restricted. It demands immediate attention and action. We must act now to protect the health of Delhi's citizens. Government officials and activists are calling for stricter regulations and immediate measures to combat this crisis. The perfect storm unveiling the culprits. The current crisis is a result of multiple factors, each contributing significantly to the deteriorating air quality. One major contributor is the post-Diwali fireworks, a tradition that, while festive, has severe environmental repercussions. The bursting of firecrackers releases massive amounts of smoke and harmful chemicals into the air, including sulfur dioxide and nitrogen oxides. This significantly worsens the air quality, making it hazardous for residents, especially those with respiratory issues. Another major factor is crop burning in neighboring states, a practice that has been ongoing for years. Farmers burn crop residue after harvest to clear fields quickly and cheaply, despite the known environmental impact. This practice releases large amounts of smoke and particulate matter into the atmosphere, contributing to the thick haze. These pollutants travel to Delhi, adding to the city's pollution woes and creating a blanket of smog. Construction activities and vehicular emissions within the city also play a significant role in the pollution crisis. The dust from construction sites and exhaust from vehicles release pollutants like particulate matter and carbon monoxide. These pollutants contribute to the deteriorating air quality, making it a complex issue that requires immediate and comprehensive action. Emergency measures are a band-aid on a deep wound. The government has implemented emergency measures to combat the severe air pollution crisis. These measures are part of the Graded Response Action Plan, or GRAP, which is designed to tackle pollution in a phased manner. Stage 3 of GRAP has been activated, indicating a critical level of air quality deterioration. Schools have been temporarily closed to protect children from the harmful effects of the polluted air. Construction activities have been restricted to limit dust pollution, which is a significant contributor to the smog. The government has also advised people to minimize outdoor activities and stay indoors as much as possible. While these measures are necessary to provide immediate relief, they are not enough to solve the underlying issues. They are short-term solutions to a long-term problem that requires sustained and comprehensive action. A public health crisis, the unseen victims. The health impacts of this air pollution are severe. Hospitals are reporting a surge in respiratory illnesses. Children are especially vulnerable. Their developing lungs are more susceptible to damage from air pollution. The elderly and people with existing respiratory and heart conditions are also at high risk. This air pollution crisis is not just an environmental issue, it is a major public health emergency.